Okay, so thanks for joining us, everybody. So we're in chapter 25. This is respiratory system. We're getting into kind of the major systems of the body. And I think this part of anatomy is a little easier to learn only because these are systems that you might be more familiar with. And there are big organs in them that you can see. So we'll look at respiratory system. The general organization of your respiratory system, we'll start with that. We divide it into anatomic parts and functional parts. So the anatomical parts are upper and lower respiratory tracts. We'll talk about what is included in those. And as we go through that, I'll try to include as many things from your lab exam study guide as I can. And it's functionally divided, so what it does into a conducting portion where only air transport occurs. So think this is the portion where air travels into the respiratory system, and a respiratory portion where gas exchange occurs. And that's the place where oxygen and carbon dioxide enter and leave the blood vessels. Okay, so here is the gross anatomy of the respiratory system. You can see how it's divided into an upper tract and a lower tract. This is a really simple diagram. We'll go into much further detail, but in the upper respiratory tract, we have what we call sinuses, which are spaces within the bones of the skull. The sphenoidal sinus is within the sphenoid bone. The frontal sinus is within the frontal bone. And these spaces within the skull just help to allow, they're a part of the respiratory system to help allow a sound production and humidifying the air when it enters. The nasal cavity is the area right behind the nasal opening in your nose, and we'll talk about what's included in there. And then your pharynx is the word for your throat. So your pharynx is just another word for your throat. It starts behind the nasal cavity, it continues down behind the oral cavity, and then it kind of ends right where your epiglottis would begin. Then the lower respiratory tract consists of your trachea, which is where air conduction would occur to get into your lungs. And I'm sorry if you hear a lawnmower right outside my garage for a little bit here. Let me know if you guys can still hear me throughout all this. The trachea will take the air into both lungs, the right and the left sides. The pleura is just a word for the covering of the lungs itself, and then the diaphragm is one of the main muscles associated with breathing that we learned about, and that divides the lungs from the abdominal cavity below it. Okay, so some of the functions of the respiratory system, it performs pulmonary ventilation, and that's just a fancy word for breathing. So for inhalation and exhalation. And the other main function is gas exchange. External respiration exchanges gases between the atmosphere and the blood, and internal respiration exchanges gases between the blood and the body cells. Other functions include gas conditioning, and gas conditioning I have a little asterisk next to. This involves warming and humidifying, moistening, and cleaning the air that you breathe in. As your gas is conditioned, so the air you breathe in comes in through your nose, it gets warmed, it gets humidified, and it also gets cleaned. So the mucus inside your nose traps anything harmful to try to keep it out from getting it into your lungs. Air becomes turbulent, that just means it moves. Sound production is a big function of your respiratory system. The larynx is just another word for your voice box, and that's crucial for speech and singing. That's where your vocal cords are. Olfaction has to do with smell, so this will be involved with your nose. And also defense, there is a protection against airborne pathogens, physical and molecular protection or defense against anything that you could breathe in. Okay, so the upper respiratory tract, I'm just looking at your notes here, so we kind of went through functions already. The upper respiratory tract includes your nose, your nasal cavities, and your paranasal sinuses, which are the sinuses on either side of the nasal cavity itself. Those are spaces. The pharynx is another word for throat, and the upper tract is often within the conducting portion of the respiratory system. So again, the conducting portion is just the portion that transports air through. The nose is the main conducting airway for inhaled air. This is where the gas conditioning occurs. So this is where the air that you breathe in will get warm, it'll get humidified, cleaned, and become turbulent. It's supported anteriorly by this little cartilaginous, we call it the dorsum nasi, and this is cartilage. And the nasal cavity begins as the internal component of the nose, and it ends as openings to the nasopharynx. And those openings are known as choanae. The vestibule is the anterior region of the nasal cavity, and that's where you have the little nose hairs, which nose hairs are good for trapping anything that you could be breathing in. It's lined with pseudostratified epithelium. The superior part of your nasal cavity contains olfactory epithelium, and that's where your olfactory nerves have traveled down the cribriform plate and will take in any sensations of smell. The nasal septum divides your nasal cavity into right and left portions. We talked about what makes up that septum in the skeletal system. And then on the lateral walls of each cavity, we have kind of these, we call them concha or conchae for plural. And they are just little ridges on the lateral sides of each cavity. And I'll show you what they look like. And these concha, these ridges within your nasal cavity, provide an area below them called a nasal meatus. And this air passage, I'm so sorry if you guys can't hear me. Just let me know if it gets bad. The nasal passage below these conchas where air will get conditioned or made turbulent. Let's see if I have a picture here. So here's a picture of the nasopharynx. So the part of the pharynx or the throat that's right behind the nasal cavity. You guys can see these little ridges within the nasal cavity itself. So my cursor is on the superior nasal concha, the middle nasal concha, and the inferior nasal concha. And beneath those ridges is a passageway for air to travel. And as air travels through that, it will become turbulent and humidified. Here's the cartilage. You can see your nasal bones, and then the septal cartilage that makes up the septum, and then the other cartilages that make up the nose itself. Joys of teaching from your garage. Okay. This is probably the best picture, kind of zoomed in on this upper respiratory tract. Again, the paranasal sinuses are the spaces within the frontal bone and the sphenoidal bone. Here's your superior, middle, and inferior nasal concha, those ridges on the lateral walls of the nasal cavity. Here's the nostril. The vestibule is the area right above the nostril where the hairs would be. You can see here how the hard palate makes up the base or the bottom of the nasal cavity, and the soft palate is located in the back of your mouth. When you swallow food, we're kind of getting ahead of ourselves. When you swallow food, the soft palate will elevate to try to close off the nasal opening to the nasal cavity so that no food goes up into your nose. And you might have heard of stories in grade school of kids laughing and milk coming out of their nose. Well, a forcible ejection of fluid could still get past that elevating soft palate. Sometimes you hear kids vomiting. If that's a really forceful ejection, that could come out of your nose. What else? You can see here there's some tonsils located in the back of the nasal cavity. You have some pharyngeal tonsils. You also have the opening of the auditory tube that enters into the nasal cavity. If you remember, the auditory tubes were what helped to equalize pressure coming from your ear sense. So that auditory tube will open up into the nasal cavity just to allow for equilibrium of pressure during altitude changes. The uvula is that little like boxing bag that you see in the back of your throat if you open up your mouth. So that's the uvula. and which leads us to the oropharynx, which is the area of your throat right behind the oral cavity. And then the laryngopharynx is the area of the throat or the pharynx that's right behind the opening to your larynx. Here's the big muscular tongue. You have teeth here in the oral cavity. We'll get to some of that when we go over digestive system. We have more tonsils in the oral cavity. You have palatine tonsils located in the back of your oral cavity, and then lingual tonsils kind of located right behind the tongue. And then if we just talk real quick about your larynx, the larynx is another word for your voice box. So within your larynx, this is where you'll have your vocal cords. If you look here at this structure, this is the epiglottis where my cursor is. And the epiglottis is a little flap of tissue, or cartilage actually, that closes and covers up the opening to the larynx when you swallow food. So you'll notice here your trachea is anterior where air goes down. And as air goes into the larynx and down your trachea, it passes through vocal cords, and that's what provides you with sound. Behind the trachea lies your esophagus, and that's the normal route that food should take when you swallow it. But if the epiglottis doesn't close fast enough over the opening to your larynx and trachea, some food might get into the trachea if the epiglottis doesn't close quickly enough. And we say that that's when food gets down the wrong pipe, because it literally is going down the wrong pipe that it shouldn't be. So you have some cough reflexes to try to get the food up out of the trachea and then back down the esophagus behind it. Okay. One thing in your notes, number 4, what part of this picture do you think is used by both the digestive and the respiratory systems?
The pharynx.
The pharynx, yes. Yeah, so Enrique, it's specifically the oropharynx, but you could just write pharynx as well.
Okay, so, okay.
Yeah, so technically, I mean, it just, the pharynx in general would be okay. What, number 5, opens into the nasopharynx?
The auditory tube.
The opening of the auditory tube. So the auditory tubes open into the nasopharynx. Should remember this, Tuesdays at 7. No class because of the lawn. Do you guys hear the lawnmower at all, or is this just me?
No, I don't hear anything.
You don't? Okay, good. Perfect. Thank you. All right, it's like super loud. Under A in number 5 for your notes, what elevates during swallowing to prevent food from entering the nasopharynx? Do you guys remember what I said there?
Soft palate.
The soft palate. Charisse, you're on a roll. High five, virtual. High five. Number 6 for your notes, what's commonly called the voice box?
Larynx.
The larynx. Good job. Thanks, Erin. All right. Let's moving on. Cadaver view. So this is more what we look like. Again, I think it's helpful to actually see what a cadaver would look like. We don't look like a drawing. This is what we look like. You can see the epiglottis here. It kind of looks like the shape of a tongue and how it would close and cover up your trachea when you swallow. Okay. Sinuses, I don't have many questions, really any on your notes about sinuses, but they are air spaces that make your bones lighter in weight. They're named after the bones in which they reside. You can see the 4 sinuses there, and in this picture you can see where they're located. The frontal, you have sinuses in your ethmoid bone, your sphenoid bone, and your maxillary bone. So if you hear of people getting a sinus infection, it would be an infection within these sinuses. So some sort of bacteria is growing that they have an infection built up. Okay. Commonly called the throat, here's your pharynx. It's shared by both respiratory and digestive tracts. We looked at the 3 regions that it's divided into. It's lined with mucosa, which help to trap anything harmful that you could breathe in. And it has a skeletal muscle for control of swallowing. Excuse me. All right. Sorry, just went down the wrong pipe, I guess. Hold on. Okay. So your nasopharynx is posterior to your nasal cavity. And the soft palate is what we talked about, what elevates during swallowing to prevent food from entering the nasopharynx.
Food or liquids too? I mean,
Yeah.
you did a great example.
You're right. I gave you a terrible example of vomit. Yeah, I know. Food and liquid from going out through your nose. I feel like kids tried to do that in my grade school. Maybe I went to a weird grade school, but everyone like tried to get someone to laugh and get milk out of their nose. But anyway, all right. The opening of the auditory tubes are found in the lateral walls. There's a pharyngeal tonsil in the back, and that's another word for that are your adenoid tonsils. So if any of you have had your tonsils removed, these would be your adenoid tonsils. The oropharynx, its boundaries are the soft palate above it, and inferiorly it's bounded by the hyoid bone. It's lined with non-keratinized stratified squamous to help resist the abrasion of food that goes down it. The opening of the oral cavity into the oral pharynx is the fauces, which are kind of, it has muscular arches, which you can see in your throat. And then you have palatine and lingual tonsils within the oral cavity itself, or the oropharynx. Then the laryngopharynx starts right below your hyoid bone and extends to the top of your esophagus, also lined with stratified squamous to help resist abrasion from food. So those are the regions of the pharynx, another word for throat. Then we get to the lower respiratory tract. This will contain conducting portions, so where air travels, but also respiratory portions. And again, the respiratory portions will be where gas exchange occurs. I just put this note in here. There's no gas exchange occurring in any of the conducting portions. So just a reminder that when we talk about conducting portions, being the larynx, trachea, bronchi, bronchioles, and terminal bronchioles, I'll show you what those are. These are just passageways that air travels into your lungs. The respiration, the gas exchange will occur in the respiratory bronchioles, the alveolar ducts, and the alveoli. And I will go through what those mean here in a second. These are anatomical descriptions and functions of some of the structures that we'll talk about right now. So I don't go over these charts with you, as you've noticed. I just include them in the PowerPoints to kind of summarize your studying as you're going through it. So the larynx, we'll start with the larynx, commonly called your voice box. It will connect your pharynx to the trachea. The functions here, I give you guys 5 functions and I give you some space to write them down. It serves as a passageway for air going into your lungs. It prevents ingested materials from entering your respiratory tract with that epiglottis. It produces sound for speech with the vocal cords, which will open and close. It assists in increasing pressure in the abdominal cavity. So it'll help do that with the vocal cords closing and epiglottis closing. It can increase pressure. And it will participate in both a sneeze and cough reflex. So there's muscles surrounding the larynx with nerve endings that will stimulate a cough or a sneeze reflex. It's supported by 9 different cartilages. Many of these cartilages were on your lab list, so I took most of them off. You should know the thyroid cartilage is the largest cartilage. It has a V-shaped anterior projection called the laryngeal prominence, and that's what we say it's your Adam's apple, and it's larger in males than in females due to testosterone-induced growth, usually during puberty. So as you know, a lot happens to males during puberty. Their voice gets lower, and that their voice lowering is due to testosterone being sent to the vocal cords, making the vocal cords longer. And as the vocal cords become longer, they lower the voice. So increased in testosterone, longer vocal cords lowers the voice in males. because their vocal cords are getting longer, I think that's what causes the pushing out of the thyroid cartilage. And I'll show you a picture of this, giving them a more noticeable Adam's apple or prominence. And if we were in class, I would have us look at all the guys and notice, yeah, we can see their little bump. I don't know if I can even feel my Adam's apple right now. But your trachea, here, I can't read this, the top of the slide. Your larynx, your larynx is held open by ring-shaped cricoid cartilage. And these rings of cartilage just keep your larynx and your trachea open at all times. The epiglottis is that spoon-shaped cartilage that closes when you're swallowing. And then you have smaller cartilages that also help with sound production that surround the larynx itself. So here's a good model look at, so this is an anterior view. So if you're looking at someone front on, you can see this thyroid cartilage is, I kind of call it the heart-shaped cartilage on the front side of the larynx. And the laryngeal prominence is the piece that usually juts out a little bit in people's necks that you can notice, the Adam's apple. Right below the thyroid cartilage is what we call the cricoid cartilage. And the cricoid cartilage is one of the other main 4 cartilages that kind of make up this larynx type structure. Here's your epiglottis shown posteriorly. It looks like a tongue or a little flap of cartilage that'll open and close. You can also see other teeny tiny cartilages, the muscles that will surround the larynx itself. For your lab exam, I really just focus on the thyroid cartilage and the cricoid cartilage. You don't need to know the muscles or other cartilages that surround the larynx. The vocal folds itself, so under your notes in number 7, where's the thyroid cartilage and cricoid cartilage located? You should, I think in this final lecture exam, I give you this exact picture, but it's unlabeled, so it'll be a picture question, and I ask you to identify the thyroid and cricoid cartilage. So just keep that in mind, be able to identify those on a picture. Okay. So a little more about the larynx. Your vocal folds are found within the larynx. They're comprised of vocal ligaments covered by a mucous membrane. There's the opening, it's called the rima glottitis. The glottis itself consists of the vocal folds plus that rima, which is the opening. Air gets forced through the rima, which is the opening, and it causes their vocal cords to vibrate. And that's what results in production of sound. Your vocal range is determined by the length and thickness of your vocal folds. Pitch is determined by the tension on your vocal folds, and the loudness depends on the force of air passing across vocal folds. So, I mean, whenever I read about vocal cords, I think of like opera singers or people who can sing very well, and think about the control that they are having on their vocal folds to be able to get the vocal range, the pitch, to be able to force that much air through them. I guess if you're a parent, you can also force a lot of air through your vocal folds if you're yelling at kids. But and then again at the end, the longer the vocal fold, the lower the voice. And that's in men due to their testosterone levels increasing during puberty. So here's a look at the opening of the vocal folds itself, the vocal cords, and then how they will open and close. As air passes through them, they vibrate, and that causes sound for speaking. Here's an actual look at the rima, the opening, and the vocal folds of an actual look, probably taken with a scope going down just the top of the larynx, which is kind of cool to see. Okay, so then the trachea, we're working our way down. The trachea is commonly referred to as the windpipe, and it will connect the larynx to your lung, or to the primary bronchi in your lungs. And so I kind of left that. I don't know why that got deleted there, but in your notes, number 8, the trachea is the blank, and that will connect the larynx to the primary bronchi. And you'll see that the primary bronchi are the structures of the trachea as soon as it splits one time. You should know well this little asterisk The trachea, it's also outlined in your notes. It lies anterior to your esophagus, inferior to your larynx, so right below the larynx, and superior to the main primary bronchi of the lungs. That'll be a test question. It's just helpful to say in words where it's located anatomically, where the trachea is. It's supported by those C-shaped cartilage rings that will keep it from collapsing. And that's, I know we're having a lot of notes to fill in here. That's your answer for number 1. What prevents the trachea from collapsing are these hyaline cartilage rings. And that's important so you have constant airflow into your lungs. More mucosa. So you have goblet cells secreting mucin all along the trachea. And this is just to help trap anything harmful that you could have breathed in that has gotten into the trachea. You want to keep your lungs as clean as possible because you don't want to have any buildup or blockage in your lungs. Because if you block these little bronchioles that carry air into your body, you have no gas exchange between oxygen and carbon dioxide. And without gas exchange, you're dead because all of your cells need oxygen to survive. So again, you know, COVID related, if you have some sort of lung disease and you get COVID, you know, you'll die of respiratory failure. It's just an infection that infects your lungs, which is not good. Okay, so this is a look at where the trachea is located. It's located right in front of your esophagus, below the larynx, and right before the primary bronchi. And the primary bronchi refers to the first splitting of the trachea into the first 2 splits. So the right main bronchus is the right main primary bronchi, and the left main bronchus is the left main primary bronchi. And we'll see that your trachea will continue splitting into secondary and tertiary bronchi and eventually into bronchioles. But the first main splitting, we say that that's the primary bronchi or the main bronchus for singular. This is a cross-section look at the trachea. This is a really great light microscopy look showing how the trachea is always held open because of the cartilage rings, but your esophagus is like a little piece of tissue or smooth muscle almost that is collapsible. And here is a place where the trachea, you can see it splitting, and how the mucosa lines the lumen with the goblet cells secreting mucus. Okay, so these are 2 questions that we answer in your notes. The trachea is anterior to the esophagus, inferior to the larynx, and superior to the primary bronchi of the lungs. So that's in your notes. And then incomplete rings of hyaline cartilage support the wall of the primary bronchi to ensure that they remain open. So you have rings of hyaline cartilage that start in your larynx with the cricoid cartilage, and they will continue down all the way through the primary bronchi and even into the secondary bronchi. We'll see where those cartilage rings start to disappear. So they're really keeping your airways open for a long time. Okay, so at the level of your sternal angle, which is probably where your xiphoid process would be, your trachea would split, or even above that a little bit. Your splits into right and left primary bronchi. Continued splitting leads to progressively smaller tubes as these bronchi bring air into your lungs. Each main bronchus divides into secondary bronchi, which will divide into tertiary bronchi. And you can see here, it really looks kind of like the branches of a tree to see how the trachea eventually splits all the way down into much smaller bronchi. If we look at the lobar bronchi, this is a secondary bronchi. So the secondary bronchi will split into 3 pieces on the right side and just 2 pieces on the left side. And that's because your right lung has 3 distinct lobes to it, and your left lung just has 2 lobes to it. So when it asks Roman numeral number 9, how many secondary bronchi does each lung have? Your right lung has 3 secondary bronchi, and your left lung has 2 secondary bronchi, and that's because your right lung has 3 distinct lobes to it. And I'll show you a better picture of what I mean by lobes and why. You could probably already decide for yourselves why your right lung has 3 lobes to it and your left lung just has a top and bottom lung. So many levels of branching of the trachea occur. The bronchi characteristics include further branching. These rings of cartilage become smaller and less numerous. Ring of smooth muscle sits between the mucosa and cartilaginous, supports a bronchial wall. The bronchi branch into much smaller tubes that eventually are less than 1 millimeter in diameter, which is incredibly tiny. Think about a millimeter is the line, the teeny tiny lines on a meter stick. So that's the diameter. And that when they get to be this small, we call them bronchioles. The bronchiole walls do not contain any cartilage, but they have a relatively thick layer of smooth muscle. And this layer of smooth muscle in the bronchioles allows for bronchoconstriction and bronchodilation, which will be controlled by the nervous system. The final segment of the conducting pathway consists of terminal bronchioles. And the terminal bronchioles will eventually lead into, if you go to the back side of your notes, the terminal bronchioles will eventually lead into what we have as the little alveoli and alveolar sacs, and we'll see exactly where the gas exchange occurs. So if you're looking at the back side of your notes, some of you have it. We'll be going a lot over this picture. I don't know if you can see that there, but it helps to kind of look at this picture as we're talking through this. So your terminal bronchioles will branch into respiratory bronchioles, and the respiratory bronchioles branch and lead into alveolar ducts, and they end in this alveolar sac structure. And I call these little sac structures little clusters of like grapes. I think they look like little clusters of grapes with each outpocketing called an alveoli. And each alveoli has an incredibly thin wall, and this is where gases, oxygen and carbon dioxide, will pass that wall through simple diffusion between the blood and the air in your lungs. And you'll go through how that happens in physiology, but you have capillaries surrounding all these alveoli, and those capillaries bring deoxygenated blood, and they take away oxygenated blood when they pick up oxygen. So this is another look at that picture. This is also important to know for your lab exam. This is the only place in the body where you'll find an artery in blue. And if you remember, these pulmonary arteries are coming from the heart. They're coming from the right side of the heart, so they don't have oxygen yet. So they're traveling away from the heart. They're bringing blood from the heart to the lungs to pick up oxygen. So students always get confused by this. They think this blue blood vessel must be a vein, but in the lungs, it's a branch of the pulmonary artery. So this branch of the pulmonary artery turns into a pulmonary arteriole, which is even smaller, that will travel into a capillary surrounding an alveoli. And on the other end of the capillary, we'll get a pulmonary venule, and then leading into a branch of the pulmonary vein. And again, this is the only place in the body where a vein will be red, because the vein is traveling back to the heart, but it's traveling directly from the lungs, carrying oxygenated blood. So just keep that in mind if you're looking at this picture and you're getting confused why this artery is blue and the vein is red. You kind of have to understand what's going on. Remembering the artery is bringing deoxygenated blood from the heart, and the vein, after it picks up oxygen, is taking it directly back to the left side of the heart. Okay. You might have remembered a picture like this from histology. You're probably thinking, how does this show simple squamous epithelium? But the lining of those alveoli is a thin layer of simple squamous epithelium that just allows oxygen and carbon dioxide to pass through quickly. That's kind of a cool picture of a scanning electron microscope, so a lot more powerful, showing the little pockets of the alveoli themselves. Okay, a little bit more about this. The alveolar wall is mainly formed by two types of cells. I don't ask you guys to know this too much, but the two types of cells are, just from a healthcare stance, you should maybe know, especially if you ever work with premature infants or you work in a NICU. But the type 2 alveolar cells are cuboidal in shape, and they produce what we call a pulmonary surfactant. And this surfactant that is produced by these type 2 cells decreases surface tension within the alveoli itself and prevents its collapse. So if you're still looking at this picture on your notes of these alveoli, you'll notice that they're like little ball-shaped structures. And without the surfactant produced by these cells, those alveoli will collapse. And if they collapse, that means air can't stay within them and get to the capillaries that are surrounding them. So premature infants, sometimes even full term, really any baby born before 36 weeks do not have this surfactant needed to breathe on their own. So this is why they need to be hooked up to some sort of ventilator or be in the NICU just to wait for their lungs to fully develop, specifically their type 2 cells to develop. This is also the most common cause of death in premature infants. They found some animal-derived surfactants, which can be administered to help these alveoli from collapsing. But just a clinical relative term to your respiratory system. I don't think I asked you guys questions about it, but you might see it come up again. These type 2 cells are what produce the surfactant, which helps keep the alveoli from collapsing. They also have macrophages, little dust cells, that help to engulf microorganisms and particulates. So again, everything, your respiratory system and your lungs try everything they can do to keep anything bad from entering the air. The respiratory membrane is the thin wall between alveolar lumen and the blood across. I won't go over this too much because you'll get this in physiology, which I should probably learn a lot more myself, first of all. But you can see this really thin membrane with the cells, and it's just showing how this diffusion of oxygen and carbon dioxide can quickly pass because the membrane is so thin. Here's the look of an erythrocyte and a capillary, and how oxygen will go into that red blood cell, and carbon dioxide will be offloaded into the alveoli itself. Ooh, I don't have this video. It's a gas exchange video. We'll skip over that for now. A little bit more anatomy of the lungs itself. So each lung is conical in shape. It has a base resting on the diaphragm and a pointed apex. And the apex of your lungs actually projects just above your clavicle. The costal surface contacts your ribs. So that would be the exterior kind of frontal side of the lungs. The mediastinal surface faces medially, and this surface houses a concave region called the hilum. The root of the lung enters at the hilum of the lung, and that consists of the bronchi, the pulmonary vessels, so your pulmonary artery and vein, any lymphatic vessels, and all the nerves. So this is a look at the lungs. Here's your right lung. It has a superior, middle, and inferior lobe. The left lung just has a superior and inferior lobe. And it has this little space here called the cardiac notch. So your left lung is much smaller because it allows for space of your heart. Because remember, your heart isn't directly medial in your body. It lies a little bit off to the left side. So the left side, or your left lung, has a little space or notch for the heart to sit in. The apex at the top and the base of the lungs lie on the diaphragm. Here's a medial view of your lungs. The hilum is just the area where your pulmonary artery and veins will enter and exit. Your main bronchus is there. Again, the main bronchus is just a branching of the trachea that brings air to the lungs. Okay, which lung has only two lobes, superior and inferior?
Left.
Left. The what is also called the voice box? Right. The type of alveolar cell that promotes rapid gas diffusion That was type 1. Don't worry about knowing that. The what the vocal folds, the deeper the voice.
Longer.
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 What is the main conducting airway for inhaled air?
Foot. Pharynx, right? No, pharynx. Pharynx.
Pharynx down through your trachea, yeah. And then the left lung has how many secondary bronchi?
Two.
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 So it has 2 lobes, and the right lung has 3 lobes and 3 secondary bronchi.
Okay.
Okay, so this goes a little bit more into the anatomy of the lungs. Left lung is slightly smaller, it has a cardiac impression, a cardiac notch. It has an oblique fissure that divides the lung into 2 lobes. The right lung has oblique and horizontal fissures that divide it into the 3 superior, middle, and inferior lobes. These are the segments of the lungs itself, and the segments are pieces of the lung that we divide because it's supplied by its own tertiary bronchus and a branch of the pulmonary artery and vein. So I'll just show you this segment here, this picture of these segments. These segments are important to just see where the tertiary bronchioles are going within each lobe of the lung. And then we get to pulmonary circulation, just one quick review on that. Pulmonary circulation conducts blood to and from the gas exchange surfaces of the lungs. And bronchial circulation is actually part of the systemic circulation that delivers blood to and from the bronchi and bronchioles. So just like the heart needs blood to function, the bronchi and bronchioles need blood to function itself. So that's what bronchial circulation refers to. I kind of end here and then we'll talk about aging with smoking. So we talked a little bit about how smoking, what happens to the alveoli itself. The alveoli will become enlarged and less numerous, and they'll contain black deposits. And you can see how that's what gives the lungs their black color, because the alveoli have those black deposits from the cigarette smoke versus healthy lungs. Aging in the respiratory system, so how your respiratory system changes with age, results in less elastic connective tissue. So the depth and rate of your breathing decreases. So the rate of ventilation, ventilation is 1 inhalation and exhalation. Conditions such as emphysema can decrease functionality, and emphysema is a condition in which the air sacs of the lungs are damaged and enlarged, causing breathlessness. It never feels like you can get a breath in because the alveoli have become enlarged, so there's never enough air to fill them up to go into the capillaries for adequate oxygen. Pollutants can accumulate as we age, so this just happens naturally. You can be the healthiest person, but if you live in an area with high pollution, pollutants could just accumulate in your lungs. Your alveoli could be reduced, which would cause a reduction in the amount of gas exchange. And smoking blackens your lungs, and it greatly increases your risk of obstructive disorders such as emphysema and also bronchitis. And we will stop there.